Hello there, welcome back to this Safeguarding Vulnerable Adults training course. During this lesson, we will focus on the specific roles and responsibilities of certain jobs and positions to protect the best interests of susceptible individuals. This will often link to working or organisational policies that have been put in place to comply with UK legislation and laws. In this respect, anyone who has contact with susceptible individuals during their regular routines must be acutely aware of their accountabilities. Let's get started with the lesson. Well, the simple answer to the question of who holds responsibility for protecting vulnerable adults is we all do. If any of us believe that we are witness to the abuse of another person who may be unable to stop it, we are morally and ethically obliged to report it to someone in authority. Imagine seeing an elderly neighbour with bruises on their arm and face, or a workmate being humiliated in a meeting. We should all consider the effects of this on a person and show empathy. Outside of general moral and ethical actions, many organisations and their workers have legal obligations and hold specific responsibilities regarding the well-being of vulnerable adults. This would include such roles and groups as council members, directors of social care services, police officers, NHS staff and medical professionals, NHS managers and boards, the Care Quality Commission, CQC, the Crown Prosecution Service, CPC, the Disclosure and Barring Service, social housing organisations, the Department of Health and Social Care, DHSC. Essentially, all companies and agencies that are engaged to interact with and support vulnerable adults have the legal duty to safeguard the welfare of individuals in their charge and act in their best interests. They must coordinate their efforts to minimise risk and display a zero-tolerance approach to abuse and neglect cases. The organisational leader will be held responsible for the governance of all safeguarding policies, ensuring that their workforce fully complies with them. Depending on the size and nature of an organisation, it is good practice to appoint a safeguarding lead or safeguarding officer to monitor and govern any activities regarding vulnerable adults. In some cases, they may be classed as welfare officers. In order to assume the role, they must be someone with senior authority, potentially a manager or team leader, be a full-time staff member, have passed a Disclosure and Barring Service DBS check, have at least 2 verifiable sources of reference, be contactable at all times, even outside normal working hours. It is especially important for companies in the caregiving sector to have a safeguarding lead or officer. Due to the nature of their work, they must be prepared to work with other parties in an integrated way whilst attempting to improve the quality of life for their clients or patients. So it's important to have a senior figure oversee care plans and see the big picture in terms of safeguarding and promoting welfare. They may be able to see signs of abuse where others might miss them. The designated safeguarding lead will have specific duties on top of their existing responsibilities. These will include gaining a high level of safeguarding knowledge with training and experience, promoting safe recruitment procedures for new staff members, fully supporting staff with training and guidance, following up on concerns and reported cases of suspected abuse, taking joint responsibility for safeguarding policies along with the management committee, being a primary point of contact for allegations against staff. In a previous lesson, we covered the structure and responsibilities of a local safeguard adults board, SAB, but it is worth repeating their importance. Members of the board will include representatives from the local council, police force, and medical groups. They meet, confer and act according to principles of the Care Act 2014. Their responsibilities in this respect are to ensure that safeguarding practices in local organisations are person-centred, and they will work together with other agencies to prevent abuse and neglect where possible. Local authorities will generally have a local authority designated officer, LADO, to deal with abuse cases. Cases involving adult social care will interact with an alternative contact called the Safeguarding Allegations Management Advisor, SAMA. Both roles require communication with the Multi-Agency Safeguarding Hub, MASH. A MASH is needed to fulfil several duties, including providing an initial point of contact for anyone wishing to report cases of abuse, aiming to improve official safeguarding responses for adults at risk of abuse or neglect, promote better outcomes by sharing information and supporting timely responses, enable the main communication hub by bringing together members of the SAB and other virtual partnerships. The Care Quality Commission, CQC, is an independent regulator and another important part of the healthcare and welfare system in the United Kingdom. It was established in 2009 in order to inspect and govern care services in England. Essentially, it replaced 3 existing commissions so that the quality of care provided can be monitored and improved by enabling better information sharing and supervision. Inspectors from the CQC will regularly engage with care services to ensure that their practices meet all expected criteria. They would do this by asking 5 simple questions. These are known as the Key Lines to Inquiry, KLOE, and are used to ascertain ratings in quality. Those questions raised against each organisation are they safe? Vulnerable adults are protected from abuse and neglect. Are they effective? Care and treatment lead to good outcomes. Are they caring? Workers show compassion, empathy and respect. Are they responsive to people's needs? They meet care expectations. Are they well led? Innovation and good working cultures are encouraged. With the help of these KLOEs, CQC will take appropriate actions and publish information inclusive of quality ratings for each registered service. Verified data and evidence is used to qualify these findings. Most importantly, they will pass verdicts on services that need to improve, as well as ensure that those responsible for poor care are held accountable for it and penalised in the approved manner. It is a legal requirement under the Care Act 2014 for a caregiving organisation to have policies and procedures in place to safeguard vulnerable adults. Each working policy should fulfil the following objectives: stop cases of abuse or neglect where they are suspected of occurring, reduce the risk of abuse or neglect to vulnerable adults, support the independence and rights of all adults, promote activities that improve the quality of life for vulnerable adults, raise general awareness of the needs of vulnerable adults and the different types of abuse and neglect that can occur. In broad terms, social care describes conjoined services that provide personal care for children and adults who need extra support. So, service workers in these areas are duty-bound to safeguard and promote the welfare of vulnerable adults. This can apply to regular interactions that take place in medical surroundings or within a home setting. The range of social services can extend well beyond that of healthcare. Social workers may need to safeguard and support vulnerable adults whilst engaged in other lifestyle activities. This could include educational pursuits and gaining qualifications, food subsidies during times of low income, support during police proceedings and investigation, job seeking and employment opportunities, subsidised housing and help with property ownership. In this lesson, we explored the roles and responsibilities organisations and caregiving personnel have for safeguarding vulnerable adults. This has included an examination of the structure of local authorities and also how every one of us can play a part in preventing abuse. Keep studying with us and stay for the next lesson, which explores how effective communication techniques are vital for safeguarding purposes. See you soon.